Headaches are super common, right? Almost everyone gets them. But what if I told you that some headaches are actually medical emergencies? The kind that, if you ignore them, could be fatal. Today, I'm going to tell you exactly which headaches are dangerous, how to spot the warning signs early, and when you absolutely must go to the emergency room immediately. First, let's talk about the normal, boring headaches. Most of the time, a headache is nothing to worry about. We're talking about your typical tension headaches, migraines, sinus headaches, or even the ones you get when you're a bit dehydrated. These usually creep up on you, feel like a dull ache or a throbbing pain, and get better with some rest, water, or over-the-counter painkillers. Crucially, they don't cause scary symptoms like weakness, confusion, or passing out. So if that sounds like your usual headache, you can probably relax. But now, let's get serious and talk about the dangerous ones. There are 6 types of headaches you should never, ever ignore. And we're starting with the most dangerous one of all, the thunderclap headache. People who have had this describe it as the worst headache of my life. The key feature is how it starts. It's not gradual. It's an explosive, severe pain that hits its absolute peak intensity within seconds. Imagine a lightning bolt of pain inside your head. This is the classic sign of a subarachnoid hemorrhage, which is bleeding in the brain, often from a ruptured aneurysm. Other warning signs include sudden vomiting, a stiff neck, or even losing consciousness. If this happens, it's a code red medical emergency. Don't wait. Call for an ambulance immediately. You need a CT scan right away. Next up is any headache that comes with neurological problems. What do I mean by that? Think of symptoms like weakness on one side of your body, slurred speech like you're drunk when you haven't had a drop, sudden vision loss, or one side of your face drooping. If you have a headache plus any of these signs, it could be a stroke, a brain hemorrhage, or even a brain tumor. The third dangerous headache is one that gets progressively worse. It's not just a bad headache that stays bad. It's a headache that is noticeably worse today than it was yesterday, and even worse the day before that. It might be most intense in the morning or even wake you up from a deep sleep. These are red flags for something increasing the pressure inside your skull, like a growing brain tumor or a condition called hydrocephalus. If you also have symptoms like morning vomiting or blurred or double vision, the suspicion gets even higher. This isn't a wait-and-see situation. You need to get it checked out. Number 4 is a headache combined with a high fever and a stiff neck. If you have a severe headache, a fever, and you find it hard or painful to touch your chin to your chest, this is the classic trio for meningitis or encephalitis. These are infections of the brain or the membranes surrounding it. They can be life-threatening and require urgent hospital treatment with antibiotics or antivirals. If you also feel confused or bothered by bright lights, the danger level is even higher. The 5th warning sign is related to age. Any new type of headache that starts after you turn 50 should be taken seriously. Of course, you can still get normal headaches, but the chances of it being something more sinister, like a stroke or a brain tumor, increase with age. One specific concern for this age group is a condition called temporal arteritis. Along with the headache, you might have a tender scalp, pain in your jaw when you chew, and vision problems. If this isn't treated quickly, it can lead to permanent blindness. So a new headache over 50 is your signal to see a doctor promptly. And finally, number 6. Any headache that develops after a head injury. You might think you're fine after a fall or a knock to the head. But a headache that appears later could signal a serious problem like a slow bleed in the brain, known as a subdural or epidural hematoma. Be on the lookout for danger signs like vomiting, increasing drowsiness, confusion, or your pupils being 2 different sizes. If any of these appear after a head injury, it's an emergency. Most headaches are harmless, but the ones we talked about today can cause permanent damage or even kill within hours if you ignore them. Recognizing the signs early can save your brain, your vision, and your life. Thanks for watching, and please follow for more real medical knowledge that can help you stay safe.